Podcast for podcasters by podcasters. Podcasting Smarter is the official podcast from Podbean, featuring podcasting interviews, best practices, and helpful tips. We're here to give you the tools, resources, product updates, and news to help you get started podcasting and keep your podcast growing.
Hello, everyone. We are so excited that you're here today. My name is Norma Jean Belenke. I'm the head of events here at Podbean, and I'm joined by my colleague here at Podbean, Ursula Scharf. This is such an exciting day for us. Hi, Ursula.
How's it going? Hope the audience really enjoys what we've got in store for them.
Yeah, absolutely. And we just have a really full program today. So for everybody out there joining us, this is our incredible event on chronic kidney disease, which is empowering those with chronic kidney disease, insights and strategies for improved health. So this is such an important event for us at Podbean. We have a lot of partners and companies that work with us that are healthcare providers that are within the medical field. And so as March is Kidney Disease Awareness Month, we just knew this was the time to bring everybody together and bring awareness to something that is a growing epidemic in the US. So I'm going to read our brief intro, and then we will launch into our first interview, and we'll introduce Dr. Kukla. Welcome back, everyone, to Podbean's Podcasting Smarter live series, where we have a very special live event for March, empowering those with chronic kidney disease, insights and strategies for improved health. This is not like our other events where we usually have a panel or single interview. This event is more like a summit with 4 different guests joining us from some of the incredible podcasts and networks that work with us here at Podbean, including the Pharmacy Podcast Network and the Mayo Clinic, which has their podcast, The Mayo Clinic Talks. For those of you who may be joining us for the first time, Podbean has live stream sessions like this one with top podcasters and experts. And we also have exclusive recorded episodes on the Podcasting Smarter podcast. We are brought to you by Podbean. We're a podcast hosting and monetizing platform and home to over 640,000 podcasts. To start your podcast, head over to podbean.com today. And now we're going to jump in with our first interview. We are so excited. Honestly, this is just, honestly, our team here at Podbean, we're really just in awe of the incredible guests that we have for you here today. So we're starting off with Dr. Aleksandra Kukla, who is a transplant nephrologist at the Mayo Clinic in Rochester, Minnesota. And she's going to talk about the kidney transplant journey, what treatment looks like for chronic kidney disease. And we're going to use the acronym a lot today. So CKD. It shows she's a really amazing doctor and, top of her field really in chronic kidney disease. So she's going to talk about treatment for CKD, how to reduce risk, and she's going to talk a lot about comorbidities, which we're really excited about.
So Norma Jean, I think probably one of the strongest takeaways from Dr. Kukla is the fact of the reputation of Mayo Clinic and the way that she's able to really discuss in layman's terms so that anybody can understand the impact of chronic kidney disease and some of the stages that you should be looking for, which I think is very, very important, because if you don't know what to identify, you don't know what to ask. And I think Dr. Kukla did an exceptional job of just laying the baseline information that anyone who's has an interest in health knows what particular questions to ask.
This summit is here so you can help support yourself, so you can help support your family, your community, and we want you to feel empowered. I mean, really, for us at Podbean, we want all podcasters to be empowered to make podcasts, but we also, have noticed that a lot of podcasts that are being created are from experts, true experts within the medical field, true healthcare providers. And so, this is really just such a perfect opportunity to be able to talk about things that are really technical, right? And some really trade and specific jargon is being broken down, especially, for podcasters. We're always about making things approachable. So I think the way that Dr. Kukla breaks things down and makes things super approachable to talk about, chronic kidney disease, the work that she does as a transplant nephrologist, what qualifies people for transplant, I think it's such an important message. So we're going to go now to Dr. Kukla. Here we go. Hello, everyone. We are joined today by Dr. Aleksandra Kukla, who is a transplant nephrologist from the Mayo Clinic here in Rochester, Minnesota. Hello, Dr. Kukla. How are you doing?
Hello, I'm doing very well.
Good. We're so
Absolutely.
excited that you're here with us today to talk about chronic kidney disease and obviously the transplant process for a lot of patients. So briefly, tell us about yourself, your education, obviously, to learn how to, be a transplant nephrologist and the work that you do at the Mayo Clinic in Rochester.
Sure. Thank you for this question. So I'm a transplant nephrologist. So what that means that I have completed my training in general nephrology, and I did additional year of transplant, learning how to take care of patients after kidney transplantation as well as after pancreas transplantation. And at Mayo Clinic, I'm a part of the team who evaluates patients when they come to us with chronic kidney disease for transplantation, and also to take care of the patients after the kidney transplant.
Wow. Okay. So first off, I want to hear about the process of what a kidney transplant journey looks like, from the initial evaluation to, getting the transplant, what that process looks like, the evaluation, and then post-surgery care.
Sure. So first of all, patients can be directly referred by their nephrologist, or they can reach out to us and for evaluation for kidney transplantation. They don't have to be on dialysis yet. We do see patients with advanced kidney disease when kidney function is below 20%, and in some instances, even below 25%, especially if the kidney disease is progressing fast. So the best outcomes are actually achieved in patients who are able to avoid dialysis or minimize the time on dialysis. So we welcome patients with advanced kidney disease to come be evaluated for kidney transplantation. So when the patient comes to Mayo Clinic, they will meet multidisciplinary team. So what that means is that they meet with the nephrologist, they meet with the transplant surgeon, the dietitian, they will meet their own transplant coordinators who will help them go through the process. They will meet with the social worker and other team members as indicated, depending on what health problems these patients have. So we really try to focus on general health of our kidney transplant candidates, because we understand that controlling and helping patients to control all their comorbidities as much as possible will set them up for a really successful kidney transplant. So after meeting with the team, then there comes the next part, whether the patient is a candidate for kidney transplantation or not. If they have, for example, severe comorbidities, chronic infections or cancers or a lot of vascular disease, by doing a kidney transplant, we can actually make the patients worse. So that determination needs to be made by all the team members that participate and that work with the patients directly. And that will happen during our transplant selection committee. And once the patients are accepted for kidney transplantation, then they can choose to be listed on the deceased donor list. But we also really encourage them to find a living donor, because the living donor really makes a difference how quickly we can get patients to transplant. And many times it can or help patients avoid dialysis, because there is a long waiting time for the deceased donor. So by having living donors, that transplant can happen really timely for the patients. And then outcomes are in general better. So many patients would come to Mayo Clinic because they were rejected by other transplant programs due to severe obesity. And we have developed here multidisciplinary approach to help them to lose weight, including medical as well as surgical options. Now, after the transplant, we also take care of the patients in a multidisciplinary team. So my role is to make sure that patients would take medications and we would manage side effects of these medications. We also treat associated problems, either directly related to transplant medications or just general health of the patients, including, again, diabetes or hypertension, chronic infections, sometimes cancers that may happen somewhat more often than in patients from general populations.
In terms of the post-surgery care, what does it look like from the transplant process? Once a patient has received a kidney transplant and, they pretty much have a new lease on life, there is care pretty much, I want to say, for prolonged, maybe the rest of their life, they're going to have to come in for testing, make sure the kidney is doing well. What does that process look like for patients? What does that care look like?
Right after the transplant, when patients get discharged from the hospital, the team would really stay in very close contact with the patient. So what that means for Mayo Clinic Rochester is that patients would stay around the Mayo Clinic for about 2, 3, sometimes 4 weeks. And then we only let them go if they are ready. So if the wounds would heal and there are no any major issues related either to the kidney or to the comorbidities. So we really want to make sure that patients, once they leave our institution, are in the good shape. And then they would have coordinator assigned. And that coordinator, what I tell the patients, would become their really good friend. So what that means, they will communicate on really regular basis, whatever the patient's needs may be. That includes not only watching over the kidney function. The patients would be required to do regular labs per our protocol, but also would they develop any complications or any problems related to immunosuppression, or simply if they have any questions. Now, the longer you are in the transplant journey, the less of the contact is required between us and the patient, and then less lab work is being done. Every time the patient does the labs, though, these labs are received by Mayo Clinic and reviewed by us. If there are any concerns, then we will reach back to the patients. Now, we also encourage them to really have a good contact with their own primary care physician or nephrologist, because the longer the patients are out of transplant, then this care is being kind of transitioned to their own doctors. So the patients do not need to travel to Mayo Clinic and have a lot of their health concern addressed at home. Regardless, if there's anything related to the kidney transplant itself, we're always there to help them and manage it.
In terms of how great the quality of life is improved for people experiencing chronic kidney disease and how long that quality of life is extended, can you tell us a little bit about that as well?
So sure, that's a great question. So I think in terms of life prolongation, it varies, but in general, for the younger people, that may mean that the life is prolonged by as many as 20 or 30 years for our younger patients. And the quality of life changed dramatically because dialysis is only a replacement of the kidney function. So it really does replace a very small percentage of the natural kidney function. So during dialysis, these toxins continue to accumulate, and patients on dialysis are at a very high risk for all the complications, including cardiovascular disease, myocardial infarctions, strokes, infections, and so on. After the kidney transplant, when patients receive a good kidney, that kidney will take, that kidney is supposed to function well, and some patients have as much as maybe 40 or 50% of their original kidney function. So that is enough to sustain patient in the really good health for many, many years. And patients have their dietary restrictions lifted. For example, they no longer have to worry about the phosphorus binders or other supplements that are so needed during dialysis. They have freedom to travel. They do not have to be hooked up to the machines, and they have a lot less health complications. So although we're still watching them or following them for cardiovascular disease, for cancer or so on, the incidence in general is a lot lower.
As a transplant nephrologist, that's really part of your role as well, to really evaluate patients for transplant to help them get there. I guess my next question is, what are some of the challenges that you see patients face that prevent them from being eligible or from receiving a kidney transplant?
So number one, I would still like to say again, and apologize for the repetition, that the earlier the patients come to us, probably the journey will be a lot easier for the patients. Patients who come to us after sometimes years on dialysis, their health is very affected. So that's the major challenge to get them to transplant healthy. And they sometimes may develop a significant cardiovascular disease. They may develop the vascular changes that precludes the surgeon to hook up the kidney safely to the vasculature of the patient. So So coming here early and being listed for the kidney transplant early is very important. The other conditions that we are looking at is if someone has a really poor heart, so that person is unlikely to benefit from the transplant and may have a lot of peri-surgical complications. If someone, for example, has chronic obstructive lung disease related to years of smoking, that will be important. Again, patients with obesity, many institutions would set the BMI criteria for these patients because of the risk associated with obesity in terms of healing after the surgery and recovery after the surgery, as well as obesity-related complications like hypertension, diabetes, that can affect the success of the kidney transplantation and a healthy kidney allograft. So that we see it more often now, and that's why we designed the program to help these patients to get there. If the patients have cancer, so these patients probably cannot be transplanted because the immunosuppression that we are giving
Right.
patients will increase the risk of malignancy and metastasis. So these patients cannot be transplanted.
Absolutely. And I think also, speaking about people coming in early is interesting because from our understanding, there is a shortage of nephrologists in many areas.
Right, that is unfortunate. Yes, so we partner with our primary colleagues, primary care colleagues, and family doctors sometimes to help us with post-transplant management. Now, every patient who develop advanced kidney disease should be seen by nephrologists because that does require really specialized care. I believe that now maybe ability of having telemedicine will help somewhat with the shortage. And helping patients as well as primary care providers to connect and provide at least some guidance.
Absolutely. And what can primary care providers, what kind of support can they offer their patients with chronic kidney disease? What can they look out for, and what resources do they have? So for all the doctors out there that, what do they look out for?
Sure. I think it is very important to screen for chronic kidney disease. So there are central health conditions, for example, diabetes, high blood pressure, sometimes chronic infections like hepatitis C, hepatitis B, HIV, or so on, or autoimmune disease, or if the patients are taking medications that can affect kidney health. Those are the conditions that really should alarm primary care physicians, and they should screen their patients using simply a blood test as well as the urine, because early diagnosis of kidney disease is very important. Now we have more and more medications that are being used that help to slow down the progression of kidney disease. So that's something that always we recommend that our primary care colleagues would keep in mind. In terms of resources, there are many guidelines that have been developed over the last several years that they do incorporate those new medications, and they create a whole algorithm depending on the patient's individual situations or comorbidities that could be kind of a guidance for the primary care colleagues to know which medication and in what situation use.
What are some of the most recent developments that you've seen that you're really excited about?
All right. So there are several. So number one is this medication called SGLT2 inhibitors that are not only helping to slow down the progression of the kidney disease, but also positively affect the cardiovascular health. Unfortunately, many of our patients, I should probably say all of our patients who develop chronic kidney disease are also at the high risk of cardiovascular disease. So having a medication that not only affect the kidney, but also directly could affect the cardiovascular health is very important. And these SGLT2 inhibitors are being now commonly used in the clinical practice. Initially, they were developed for patients with diabetes, but they're also being used for patients who do not have diabetes now, and they showed good, promising results. So that's one of the group of medications. There are another group called GLP-1 receptor agonists, which are good for diabetes, but also good for obesity. Obesity, as we already discussed, may negatively affect the kidney health, pre-transplant, post-transplant, also accelerate the progression of kidney disease if the kidney disease for any other reasons, and that obesity is associated with poorly controlled hypertension, poorly controlled diabetes. So treatment of obesity should be really important. Of course, lifestyle is always the cornerstone of treatment. But if the patients cannot achieve a good control of their weight issues by healthy lifestyle, then there are some other medications, for example, mineralocorticoid receptor antagonists, that are also being more commonly used. So lots of tools in nephrologist as well as primary care physician toolbox to choose from. And I hope that the future will be a lot brighter for the patients, because with these medications, we can actually slow the progression of the kidney disease.
It really speaks to how interconnected health is, right? Kidneys versus comorbidities versus overall general wellness within a person's body are all factors to how they're going to respond. And then also, like you said, diagnosing early, making sure, if you have any questions, you talk to your primary care physician, you ask to be screened. I think this is really important as well, just to make sure that your kidney function is optimal.
It is very important for the patients to be aware also about their risk factors and partner with primary care physician for the optimal health, starting from the screening, understanding what the kidney disease is, understanding what we are looking at when we assess kidney disease.
Well, Dr. Kukla, it has been just such a pleasure. Thank you so much for taking time to speak with us today.
My pleasure. Thank you so much.
Wow, that was just such an incredible conversation. And I think we're just so privileged here to have Dr. Aleksandra Kukla join us, speaking about transplant nephrology, speaking about what that looks like, what people need to qualify, how you should come in early, I think is such a really important aspect of it as well.
Agreed. I think when you're dealing with a chronic condition, the more that you can do to really kind of chart out your future to the best of your abilities. And Dr. Kukla definitely provided the information that anyone needs that's in that position, because we live such long lives. And medical interventions are keeping us alive longer. We're living higher quality of lives, even with chronic medical conditions. I think it's really good to know what your options are, what you are facing if you are looking at a kidney transplant. And she did it in such a way that it's not intimidating, nor is it anything that you should be afraid of.
What a privilege. Thank you so much for joining us, Dr. Kukla. And next, we have also an incredible guest, Dr. Swathi Varanasi, who is an integrative health pharmacist. She's also the host of the Element Apothec podcast with the Pharmacy Podcast Network. And they have just an incredible network of shows that really is for and by healthcare providers within the pharmaceutical industry. So it's the knowledge there is just incredible. And she's going to speak about the role pharmacists have with kidney patients, coordinating care. Because, when you think of a pharmacist, you think, oh, I'm going to fill a prescription and then I'm going to get my medication. But they do so much more. And she's really going to speak about how pharmacists play this really important role in chronic kidney disease with patients, coordinating care, making sure that interventions are effective, and working with common challenges for CKD patients.
It's more than just dispensing meds. It's really educating patients. It's getting everyone on the same page. Once you reach the point that you do have chronic kidney disease and you do need transplantation, it can be very overwhelming to talk about the expense of the meds, how they're administered, the impact on the body. And I think that really bringing up these challenges that CKD patients will encounter in the future once transplantation happens is very important. This whole panel today is really just empowering people with information so that you're better prepared to make decisions.
Absolutely. Well, here we go with Dr. Swathi Varanasi.
Hello, everyone. We are now joined by Dr. Swathi Varanasi, who is an integrative health pharmacist and host of the Element Apothec show with Pharmacy Podcast Network here at Podbean. Hello, Dr. Swathi. How are you?
I'm great. How are you doing?
Good. We're so excited to have you here today. So let's get started. As a pharmacist, people don't often realize the level of specialty knowledge that goes into the profession as a healthcare provider. So can you discuss your specialized knowledge of pharmacology and how it informs your approach to patient care?
Yeah, absolutely. So yeah, a lot of people don't know that pharmacists have what's called a Doctor of Pharmacy degree or a PharmD. So we go through a very similar curriculum to the Doctor of Medicine schooling. And so there's a lot of focus on disease state management, but we have more of a focus on the pharmaceutical agents and the supplements and all of the treatment modalities more than the actual diagnoses portion. But pharmacists are the medication experts. And so, we're the ones that are, the most accessible healthcare professional. And I think that that's so important, especially in the grand scope of care. And even after 4 years of pharmacy school, so I guess to even back up before that, so you can do your undergrad in really anything as long as you complete your pre-pharmacy or pre-health requirements. And then you can deep dive into pharmacy in a 4-year post-grad degree. And then after that, you can further pursue a specialty. And so you can do a residency. And so those are anywhere from 1 to 3 years long. So you apply, get selected, get matched, all of that. And, one of the most important things I learned in pharmacy school that I talk about with my colleagues all the time is really this concept of evaluating benefit versus risk. And the idea of optimizing efficacy while improving safety for every single patient. And something that I've learned along the way that, led me to specialize in integrative health and be an integrative health pharmacist is this idea of personalized medicine. And, it started off as an idea and a concept, and now I see it as such a broad range and such a bigger discussion than it ever has been before. So integrative health, everyone defines it differently, but to me, it really is the interplay and discussion and combination of the use of pharmaceutical agents or medications with a lot of other lifestyle modifications and other things that we can do to improve our overall health and wellness for, of course, ourselves, our loved ones, and our patients. And so by, other modalities, I think of nutrition and movement and sleep and herbal therapy and the use of genomics and research and so many other different components that really come together to provide this comprehensive, holistic picture of what health looks like.
Let's talk more about chronic kidney disease. So what are the most common drug therapies used to manage chronic kidney disease, and how do they work?
It really depends on where they are and, how their kidneys are functioning. And, the kidneys are so intrinsically linked with so many other, physiological systems in the body that, oftentimes if a patient has chronic kidney disease, it also means that it's impacting, how their heart's functioning, how their cholesterol levels are. And so a lot of the drugs that I'll mention, you might actually see them in a lot of other disease states too, because they have a multifaceted purpose. And so one of them is high blood pressure medication. So these are ACE, for short, or ARBs are kind of what they're called for short. And, these are known as common high blood pressure medications. Oftentimes people with chronic kidney disease do experience an elevated blood pressure, what's called hypertension. And so if we're able to use these blood pressure medications, actually we can help relieve some of that pressure, or another way to say it is how hard the heart is working to pump blood throughout the body. So if we can put less stress or, enable it so the heart is not working as hard, then we can also relieve that same, level of pressure on the kidneys. So that's kind of one of the concepts behind why we would use a blood pressure medication in this scenario. And then, another thing, especially with chronic kidney disease, there could be electrolyte imbalance. You would think of on like the periodic table. So things like calcium and sodium, potassium, things like that. And so there could be a lot of like swelling, or another word for that is edema. And so oftentimes patients are put on what's called a water pill or a diuretic. And so that really helps them flush a lot of this extra fluid buildup. And sometimes this fluid buildup could be related to, pain at the joints, pain in other areas. But overall, just it improves the quality of life of the patient so much because they're able to, not have this extra water weight, so to speak, or this extra fluid buildup. And then also certain patients that are diagnosed with chronic kidney disease may have a low iron level. And so they might be given a medication called erythropoietin wheaten. And there's some other medications like that as well that really help enable the production of more red blood cells. And so, with these more red blood cells, that can really help with if patients are experiencing weakness or tiredness or fatigue. And then, if chronic kidney disease gets to the point where medications are no longer an option because a patient is experiencing what's called kidney failure, then the patient would either need to be on the transplant list to have another kidney, or they could also undergo dialysis. Those are kind of, the end stage options. Thankfully, that's, something that is very attainable for most patients. It's just, that waiting process and figuring out if, dialysis is the right choice or transplant or a combination. And then the other thing too is a lot of patients experience high cholesterol in combination with chronic kidney disease. And so cholesterol medications that are very common are statins. And so that could be, rosuvastatin, the words, the drug titles, that have the word statin in them. And those are really great for decreasing our bad cholesterol, so to speak, or our LDL cholesterol. But something that's, very important, especially from a chronic kidney disease standpoint, of course, from a personalized drug standpoint, that these medications, along with quite a few others, need to be adjusted because statins are actually metabolized or broken down by kidneys.
Yeah, absolutely. And we've spoken to some of the specific drug therapies, I think, with Dr. Kukla. It's something where, kidney health is so integrative to the overall health of a person, right? And it's something that I think has come up more and more as we've spoken today with so many incredible experts. But, your body isn't one thing in your body isn't a singularity, right? Everything in your body works together to make sure that you're healthy. So when you if you do experience chronic kidney disease, it's something where, so many other things may be affected. And what are some potential side effects and drug interactions that patients with chronic kidney disease should be aware of when taking medications?
Yeah. So, there are quite a few, but again, this is very patient specific. And so if you're taking, for example, a blood pressure medication, depending on where the patient started from and what that, where their blood pressure was, if they started taking a blood pressure medication, it's possible that, the goal of a blood pressure medication is to lower the blood pressure to a more normal level, so to speak, or what modern medicine considers as a normal level. And so, if we take too much blood pressure medication, then we can get to what's called hypotension. And so that means that we're going to have low blood pressure. So that's not what we want. Right. So, some of these side effects are, when the drug therapies are not optimized for each patient. So that's one example. Another one, especially with the kidneys, is that and I'm not sure if other people already talked about this, but, when we're thinking about all the medications that are on the market right now, the vast majority are broken down by either the kidney or the liver. And so, because there's so many medications that are broken down by the kidney, it's really, really important that if a patient does have, impaired kidney function or chronic kidney disease in general, that we need to figure out exactly how to change the doses, because we don't want to build up of certain medication if the kidney is not excreting or metabolizing in the, optimal way. So at the end of the day, the overarching, theme for drug interactions, I would say, really comes down to, are we optimizing every single medication that the patient is taking, looking at how it's broken down, and then figuring out if we need to change the dose accordingly? Another one associated with drug interactions could be, heartbeat irregularities or arrhythmias. That could be another one as well. And then, as I mentioned before, with the electrolytes, we need to have a very, particular amount of every single electrolyte in our body to be functioning at our best. And, the kidneys play such a pivotal role in electrolyte balance in the body. And so that is why, especially when we're incorporating other medications that influence the way that the kidney is working, it's really important that we get frequent blood tests as a chronic disease state patient, as a chronic kidney disease patient. It's really important because, with the addition of one or two other medications that could be impacting the kidney, then that could throw off the electrolyte balance. And then that could in turn, manifest in a lot of different ways and a lot of unwanted ways. So that's really important. And then also, as I mentioned before, it's more than we think, because oftentimes when we're taking medications or even supplements, we don't think about, oh, how is this broken down? How is this going to influence, the rest of my regimen that I'm normally taking? But, medications like proton pump inhibitors that are often used for heartburn, as well as other antacids, certain antibiotics, even NSAIDs. So, things like ibuprofen are also broken down by the kidneys. So it's really important that if patients are, used to taking one here and there for pain or anything, that they keep an open dialogue with their healthcare provider, inclusive of their pharmacist, so that, when they do go up to the pharmacy and pick up their medications, or maybe they're at a visit in the hospital and they're all speaking to the pharmacist that works in the hospital, that they are very clear about, okay, these are all the medications I take regularly. And actually here and there as well, I also take ibuprofen. I take, my Nexium here and there, because you can get that over the counter. And to be very clear with what you take, because all of it plays such an important role. And just because you don't need a prescription for something doesn't mean that it couldn't impact, your overall body functioning, for better or worse.
But I want to ask now about how pharmacists help patients manage comorbidities, because we've heard a lot about comorbidities and related to chronic kidney disease in conjunction with dietary modifications and lifestyle changes. So how can pharmacists help patients there?
Because, as I mentioned before, and, one of my favorite things about being a pharmacist is that, pharmacists are the most accessible, not only the most accessible healthcare professional, but they're also the drug expert. So one of the things that I recommend as a pharmacist is that every patient keep their medication list with them at all times, like in a notebook, in a note in their phone, in some capacity, whether it's, the patient taking care of themselves or their caregiver. Someone should have access to their up-to-date medication history, or not even history, rather, their current medications is what's the most important. If you also had a medication history about like, oh, we did try this particular statin, it did not work for us for XYZ reason, that's also very helpful. But if nothing else, to have a current medication list with the name of the medication. Oftentimes medications, it's a little complicated from a patient standpoint because they have what's called a brand name and a generic name. So trying to ensure you have both of the names on there, you have the dosage, how many times you're taking it a day, how often you actually take it. Cause, maybe, one of them you have to take at night and you oftentimes fall asleep, too early while reading your book or something like that. So it's really important to also put how many times you're actually taking that medication, because as you go to all these different doctor visits, you need to have some comprehensive, quote unquote, source of truth of all your medications so that you can help your healthcare provider help you. So that would be, one of the things that, pharmacists can play a big role in. And, even just checking in on the patient when they pick up their medications. I know a lot of pharmacies are very, very busy, but, some independent pharmacies tend to not be as busy. If you can have that moment with your pharmacist to be like, and especially if you're there and you're like, oh, I want to pick up some Nexium or, something else over the counter, to just ensure at checkout, like, oh, I was thinking of taking this and I'm also picking up, all these medications for my chronic kidney disease. Is this okay? To just have that open dialogue, I think is so important. And one of my mentors always said that the most dangerous drug or supplement that the patient is taking is the one that we don't know about, because that's when there can be drug interactions and that's when there can be a lot more issues that could be avoided if we're able to have that open discussion.
Absolutely. Absolutely. And, we're all human, right? So if you miss a dosage or if you, like you said, if you're reading your book or you fall asleep early and you forget to take a medication, it's so important to communicate that because your healthcare providers, your pharmacists won't know, right? Your doctors, your nephrologists won't know if a drug is effective if they don't know exactly how much you're taking. So that's such an important aspect as well. And don't be afraid to be vulnerable about it. I think it's okay to say, hey, I made a mistake, or hey, I have this pattern, I fall asleep early, but to come in with truth, right? Because your healthcare providers can't help you if they don't have the most complete picture. So that is such an important aspect as well. Yes.
Exactly. And I also wanted to add too on that is that healthcare professionals are taught in school, and, people who want to pursue this type of career, they are not judgmental. So they are not going to, if you miss 2-3 doses during a week, like, we'll be so appreciative if we just hear that, okay, that's what happened. That explains why, your certain electrolytes are at this level, and it will make so much more sense. Like, we're the last people to judge. We just are trying to understand and help.
And I want to ask you next, what are the most effective interventions, both medically and through diet or lifestyle change, especially as an integrative pharmacist, for managing comorbidities related to chronic kidney disease, such as diabetes and hypertension?
As an integrative health pharmacist, it's really important to me to look into what research has been done on, being a pharmacist. I'm always obsessed with looking at the research and, what's actually out there so that I can provide patients with the right, the right steps forward to really help them. So, and something that I also really like to do is, not only say like, oh, you can't eat this, or, you shouldn't eat this. It's more of, oh, instead of one thing, maybe let's replace it with something else to put like a positive spin. And then, I would also recommend, as the course of chronic kidney disease and the journey of the patient, it's really important to focus on bone health. And so there are a lot of really great supplements out there for bone health, but also there's, things like vitamin D3 with K2, like that complex is incredible, as well as calcium. And, it's not just limited to the supplements. Like, I would say the best way to get these vitamins is through, a rainbow rich, nutrient dense diet. And so, a lot of the, like the green leafy vegetables and, there's so many incredible ways to do it. And one of the things that I talk about with patients is every time you go to the grocery store or every time you go to the farmer's market, if you have access to one, is to try one new thing that you've never tried before, because it's so good for your gut microbiome. And it's also so good to get those different nutrients that you might not have gotten otherwise. And then, of course, you can still buy all the normal things that you love from the fruit and vegetable standpoint. But I would say just try to, go out there and try some new things. And then, with protein, it's very interesting. There's a lot of conflicting research on, high protein versus low protein for chronic kidney disease. Overall, I think what's best is modern protein intake. And so this would be for lean fish, lean meats, not very high fat. Again, thinking about like a low cholesterol focused diet. And then also thinking about protein from, and a more quote unquote unconventional standpoint from a standard American diet. Perspective is, the incorporation of nuts and seeds and legumes and beans and those types of things that have a lot of healthy fat, a lot of healthy carbs, but also provide really great protein as well. So I think from a diet standpoint, those are the majority of I guess the other thing too is to try to limit refined sugar. So refined sugar is, the white sugar and what you see in a lot of processed foods. But, if you're home and you're making your morning yogurt bowl that I just ate a few hours ago, then, you can put maple syrup on the top. You can put honey. So things that are not refined, that are a bit more natural sources of sugar. Because I still want people to enjoy their lives and to have the sweetness. But I think there's there are other ways to do it. So those are the things from like a diet standpoint that I think are really great. But then from a lifestyle standpoint, just getting movement in every day, that could look so different for so many people. For some people, that is a HIIT workout every single day. For some people, that's a 30-minute stroll. But I'm more interested in what the patient enjoys and what they're willing to do. And I always like to figure that out as like, so like, what do you like to do for movement? Like what gets you excited? Is it catching up with your friend and then calling them when you're on a walk? Because that's a great way to catch up with a friend, but also get some movement in. So there's a lot of really fun ways to incorporate movement that's not like, going to the gym and lifting weights every single day.
Yeah, absolutely. And, most people wouldn't think this is the thing you talk to your pharmacist about, but everything kind of contributes as a factor. And I think as an integrative pharmacist, especially when we're talking about chronic kidney disease, so many things are going to influence your health, right? So many things are going to be factors, right? Ingesting medication, ingesting food, what goes in, what goes out, everything is related. And my next question kind of goes into how pharmacists collaborate with other healthcare providers. So you're collaborating, like you mentioned, a patient is seeing their general internist, right? They're seeing their nephrologist, they're seeing their pharmacist. There's so many people that they're having interactions with, and that coordination may not be there, but the pharmacist is kind of that last stand. How do pharmacists collaborate with other healthcare professionals to provide comprehensive chronic kidney disease care?
One of the ways that I think is really incredible is this idea of a collaborative practice agreement. So I see this a lot in hospital settings, in clinic settings, where the pharmacist is kind of, the one in charge of all things medications, all things, discussion about lifestyle, and work in collaboration in that way with a, signed contract that, I'm going to provide my expertise and you're going to provide yours and we're going to do this together. So, and I don't think that a lot of people think about collaborative, practice in this way, but to me, it's, maybe I don't know the answers to XYZ thing, but I'm able to refer the patient to someone who does, who I trust within my, professional network, or maybe they want to learn more about, movement or something. And then I know someone that they can go to, but someone that, you're passing off a patient and you're doing it with the right idea, but also really, ensuring that when you're providing these referrals that you're also able to say, okay, this is the background on the patient. So having that power as a healthcare professional.
And I want to talk to you next about common challenges that patients with chronic kidney disease face when it comes to managing their medications. Like you mentioned, and I think probably a big one that you've already mentioned is that, forgetting to mention when you don't take when you don't take a dosage, right? Or if you aren't regular with how you take a medication. But how can pharmacists address these challenges?
Yeah, so I think that one of the challenges from a patient standpoint, especially patients that have a chronic disease like CKD, I think that patients often get put in a box, which is really upsetting to me as a healthcare professional because every patient is so different and has a different experience, is in a different stage of their kidney, journey. And so, I don't want patients to think that they're just their GFR, they're just their, numbers, and they're just their electrolyte numbers and things from their tests. Patients are holistic, important. Every single person is important, and we need to create these personalized treatment plans that do incorporate medications, but also incorporate other things like lifestyle. And I think our goal as healthcare professionals is to really empower the patient. And that's why I really love what I do in integrative health is I'm able to provide, if someone comes to me and says I'm having issues with sleep, then I can say, all right, let's talk about diet. Let's talk about movement. Let's talk about mindfulness. Let's talk about your medications. Let's talk about supplements, and really trying to figure out what's going to resonate with the patient. And so I think that oftentimes the challenge is that a patient doesn't feel heard. And I really think that, as a healthcare professional and as, our team of, collaborative healthcare professionals, that's something that we really need to focus in on is how can we speak to the patient in a way that works for them and a way that's really going to help them in the way they want to be helped.
Yeah, absolutely. And, I think overall the main takeaway is that, not to treat patients as their disease, but as a person, right? And everything is a factor, but also to communicate with them and to reach them on a human level. You have to look at all the different factors, not just chronic kidney disease, right? But so many different factors, because it's really just a facet, a singular facet, and
exactly.
it may feel overwhelming, or it may feel like it's the main thing happening in their life, of course, but also there are other factors, and to treat all patients, with that integrative approach. Well, Dr. Swathi Varanasi, thank you so much for joining us. This has been just such a pleasure. Thank you.
Oh, thank you so much for having me and including me and including pharmacists in this discussion. Like that means a lot to us as a profession, because, we play such a role in the management of chronic kidney disease, and it really is just such a team effort. So we appreciate it too.
That was such an incredible conversation. And I think there's just so much that pharmacists do that, when you think top of mind, you're not thinking diet, you're not thinking conflicting medications, you're not thinking patient care, you're not thinking, oh, did someone miss a dose, right? And to have that communication with your pharmacist, just such an incredible conversation. Dr. Swathi, thank you so much for joining us. We're so grateful to have your expertise here today. Just what an incredible conversation. And we have a really exciting guest next. We are going to be joined by Dr. Prayus Tailor, and he is the managing partner of Nephrology Associates in Delaware. And he's the former president of the Medical Society of Delaware. So, an expert.
Exactly. Yes.
Yeah. And he's really going to speak about, chronic kidney disease and the role that dialysis plays, how dialysis works. Because I think a lot of people there's a stigma there, but then there's a lot of misunderstanding, right? What is dialysis? How does it work? And how patients can improve their experience with home dialysis and common misconceptions, right? So I think it's something where he's a top nephrologist, and just really having him break down what that journey looks like for patients is so important. We're so excited to share this conversation with you.
Yeah, yes, he does an amazing job of really just laying out what it means. It's not a death sentence. Many people hear dialysis, they feel that their life is over, and really just giving a level of understanding that is a way to cleanse your body, remove the toxins, hopefully to prepare you for transplantation. But if you decide that a transplant's not right for you, you still can live a quality life on dialysis. You're still able to do many of the things that you did pre-dialysis. So I think it's important to hear from someone that believes in dialysis, both in-center and home therapies, and just kind of removing some of those stigmas. And which is very, very important. Dialysis does not mean death.
Yeah, absolutely. Well, here we go with Dr. Tailor. I'm so excited to share this with you. Here we go. Hello, everyone. We are so excited today. We're joined by Dr. Prayus Tailor, who is the managing director of Nephrology Associates in Delaware, former president of the Medical Society of Delaware, and has the most at-home dialysis patients in the region, and is also the medical director of Delaware's first standalone home dialysis unit. Hello, Dr. Tailor.
Hi, Norma Jean.
Thank you so much for joining us today. So we're going to speak a little bit about what the process looks like for the overall dialysis period of a patient's life, what therapies are available, and what that journey looks like. So first of all, can you just provide us a little bit of an overview of the different types of dialysis available and what patients should consider when they're choosing a therapy?
Absolutely. So basically, there are two types of dialysis. And if I want to break it down in the most basic terms, there's blood dialysis and there's non-blood dialysis. Blood dialysis is called hemodialysis. And this can be done in a center where one typically goes 3 times a week, or it could be done at home. And the non-blood dialysis uses a sugar-like fluid that is instilled into the abdomen, and it sits there for a while, and then you drain it out. And this can be done either manually or through a machine. But basically, if you think about what the kidneys do, they're filters. They clean your blood.
Yeah.
They do a whole host of other things, but that's one of the things that they do. And so if you need to clean the blood, you need to get access to the bloodstream. So hemodialysis does that through what's called an AV fistula, which is a surgically created vein in your arm, typically. And if the veins are not good, then they can use an artificial piece of material like Gore-Tex to create that vein. And then you put 2 needles in that, and through one needle, you remove the blood and it runs through the dialysis machine. It gets cleaned and extra fluid gets removed. And then that blood comes back to you. And so that's basically what hemodialysis is. And now peritoneal dialysis, which is a non-blood dialysis, uses a sugar water that is instilled into the abdomen via a somewhat of a plastic tube. And that sugar in that a fluid basically pulls out water and other toxins from your bloodstream through the small capillaries that line the abdomen. And that's how that cleans the blood. So then it usually sits in the abdomen for a few hours, and then you drain it out and you put some new fluid in, and then you drain it out. And that can be done manually during the day. Or there's a machine called a cycler that some people use at nighttime that does it for them.
And what are some of the common challenges and complications that patients encounter when they're undergoing dialysis?
The challenges may have to do with scheduling. It's kind of like a part-time job if you're going to a dialysis center 3 times a week, 4 hours each time, incorporate, going there and getting back, and it's a good 6 hours 3 times a week, and then if you're doing it at home, it's not like it's less time per se. So I think one of the things to think about is where do you prefer to be? What do you want to do? The challenges that patients feel may have to do with dialysis itself. Sometimes people will feel fatigued after dialysis. They'll feel tired and want to rest, and then it takes them a few hours maybe, or even the next morning to get back to themselves. But a lot of that depends on how much fluid we need to pull off with each dialysis session, or how, if they have significant anemia, which is a low blood count. Another challenge that sometimes patients can experience is infection, either with the dialysis access, or if you're on peritoneal dialysis, sometimes people can get an infection within their abdominal cavity, which is, not comfortable at all. But the goals are to treat the infections quickly and get them resolved before they can become more sinister, obviously. So, a lot of this depends on how well patients can stick with the plan, stick with the regimen, follow steps 1, 2, 3, 4, 5 exactly as it's outlined, and obviously maintaining everything in a sanitary fashion is very important.
So tell us a little bit about how in-center dialysis compares to at-home dialysis in terms of, you mentioned the quality of life, but in terms of effectiveness and what patients should consider when deciding, because
I think this boils down to, if you think about what your kidneys would normally do, they're working 24/7, right? So more frequent dialysis has been shown to improve outcomes with respect to heart issues. More frequent dialysis has been shown to reduce blood pressure. And it's been shown to also reduce the amount of pills that someone needs to take to control all the other side effects of kidney failure. So I do think that home dialysis, because it's more frequent, offers a distinct advantage over in-center hemodialysis, which is only 3 times a week.
In terms of diet and nutrition in maintaining chronic kidney disease, how does that play into patients' lives?
Well, I think when you're talking about any chronic disease, you always have to, go back to the old adage of an ounce of prevention is worth a pound of cure. And, if you think about the number 1 and number 2 cause of kidney disease and kidney failure in the world being diabetes and high blood pressure, and how we know that these processes can be managed and modified by diet. The more frequent dialysis you have, the more you can clean your blood, and therefore you can be a little bit more liberal with your diet.
How can families and patients best prepare for dialysis, both from a logistical standpoint, like you mentioned, and I'd love to hear the home dialysis side of this as well, but also emotionally, I think it's probably a big transition as well.
Yeah, this is something where I think knowledge is power, right? So when is the time when the patient's most readily able to accept the information and process it? And that's a difficult thing to figure out sometimes. there are patients who I have that, they're as they're progressing through kidney disease and approaching end stage kidney disease, and we have to start talking about dialysis and kidney transplant. They're all ears. And then there are those people that kind of, they look like they're listening, but the next time I come and see them, they really haven't followed through on any of the recommendations in terms of getting education or getting evaluated for kidney transplant or seeing the surgeon about getting a dialysis access created. And then, we're left thinking, well, why is that? Why is this person just not listening? And
Right.
I think it took me a long time to figure out that it's not that they're not listening, it's that they're scared.
Right.
And,
Could they also be in shock? I mean, it's a big shock, I think, as well.
And I think that fear is something that patients will not tell a lot of people about. The only way you can get around this is by educating yourself and making the best decision for yourself. There are lots of tools. There are other patients that are willing to speak to you. I know I have patients when I'm trying to explain things about dialysis, and I tell them, like, look, don't take my word for it. I mean, I don't have to do this, but I have patients that do it who would be more than willing to talk to you, and you can get your questions answered firsthand.
When you're dealing with the logistical side of kidney disease, a lot of people, a lot of their families, that emotional side, if you're not ready for it, can just kind of, come in and really blindside you in a way. And so I think, you're right. Acknowledging, when you're scared, if you're scared or whatever emotions come up is such an important aspect of it. And I think, and there have been some recent innovations and advancements in dialysis technology that have improved the outcomes for patients. So can you speak a little bit about that? Because I think, when people hear the term dialysis, maybe they have a specific treatment in mind that may be outdated, or there may be other options. And the world of nephrology is really advancing, and there are new technologies and practices that are available for patients.
There are things now that weren't available, 5 years ago. Or 15 years ago, when it's taken a long time even for there to be a significant uptake of the use of that. But, we have newer home dialysis machines. Every year when I go to the national nephrology meetings, there's always vendors with newfangled dialysis devices that just keep getting smaller and smaller and smaller. And now there's even, they're working on an artificial kidney that's wearable on the outside, and it's an external kidney. And, of course, we continue to work on other things that will hopefully prevent the need for dialysis altogether. It's the first time in 20 years we've had medicines that can help delay progression of kidney disease to the point where we might be able to prevent someone from ever needing dialysis. There's all kinds of things going on. I'm actually pretty excited right now about everything that potentially can occur in the future.
Yeah, absolutely. It seems like it's really a time of innovation, but we've discussed, how it's growing as an epidemic. Hearing that there is hope, but the cost of dialysis and therapies can impact patients and their families. So, can you tell us a little bit about that? In terms of how it impacts patients, but then also, I believe there are available resources for patients as well.
Yeah, at least in the United States, in 1972, Congress passed changes to Medicare where someone who was diagnosed with end-stage renal disease would get Medicare coverage no matter what their age. We think of Medicare patients as being over the age of 65, but if you have end-stage kidney disease, you automatically get Medicare coverage. So dialysis is an accessible and an affordable modality. It isn't cheap. It does cost the government quite a bit of money, even though dialysis patients make up less than 1% of the entire Medicare population. The amount of money it costs is almost about 8% of the entire Medicare budget.
Wow.
So we are constantly looking at ways to improve the technology, improve the outcomes, and at the same time reduce the costs. And that's one of the things that home hemodialysis does. It substantially reduces the overall cost while improving outcomes for a lot of our patients. So that's another reason why I'm a big advocate of it as well.
Yeah, absolutely. And can you just walk us through
what home hemodialysis is in regard to the differences between traditional hemodialysis, where you go to a center, maybe a few times a week. It's a longer process, because I think a lot of people aren't familiar with what is home hemodialysis, because it's not something that maybe has been accessible or even known. It is also, on the forefront of what's available to patients.
Typically the large majority of patients in this country, about 85% of them, go to a center to do dialysis. You go there, be greeted by the staff at the dialysis unit. You get weighed. They take your vital signs. They sit you down. They'll put needles in the fistula or the graft, and then they'll run your treatment for you. And then when it's done, they remove the needles and then bandage you up, and then you go on your way. So that is a bit, it's a commitment, because you don't have a lot of flexibility.
Okay.
And so these machines that they use in these in-center dialysis are fairly big. The home hemodialysis machines are much smaller, and in some ways, could be less efficient, but you do get the convenience of not having to, get up and go to the dialysis unit, and either the patient will put the needles in themselves, and we have many patients that do that, or they have a care partner that does that for them. And some patients are, these machines have a cartridge and you just load it up, and then there's some connections you have to make, and they're all taught how to do this. Generally at home, we do 5 times a week for about 3 hours each time, whereas in the center, it's about 4 hours 3 times a week. So
okay, and
you are getting more
what's the difference in terms of the patient's quality of life when you're doing more frequent dialysis at home? Do you feel better? Do you have more energy?
Absolutely. That's one of the big selling points of home dialysis, is that people seem to bounce back a lot quicker than they would if they went to an in-center unit. At home, I think people are feeling like themselves like in 30 minutes if from an in-center treatment.
Yeah, absolutely. Okay. For patients who are on dialysis, do they get more tired after dialysis? Is that correct?
Well, it depends, it depends on, are you someone who's, taking in a lot of fluid between your 2 treatments? Because if the more fluid we have to pull, the higher the likelihood that your blood pressure will drop during the dialysis treatment, and then you're going to feel fatigued.
Okay.
It also depends on whether you have significant anemia or a low blood count.
Yeah.
And that can be treated if you're coming to your treatments on a regular basis. But unfortunately, not everyone comes to their treatments on a regular basis either.
Okay. So, but it is a very physical process.
It is. It can take a lot out of you, but it can be managed. If you're, following your diet and your fluid restrictions and whatnot.
Yeah, absolutely. And that kind of leads into my next question about how dialysis impacts the other aspects of a patient's health and well-being, such as sleep, mental health, obviously the social aspect, especially if you're doing in-center dialysis, like you said, 80% of Americans are, because it is, like you mentioned, a part-time job almost in terms of the hours. That's 12 hours a week minimum.
One of the things about end-stage kidney disease is that we have, a not insignificant amount of patients that have sleep-related disorders like restless leg syndrome or sleep apnea. So it can impact your sleep. I think the mental health issues are something that are very significant. That unfortunately have not, really been able to be addressed in the way that most of us would like, just due to the fact that we just don't have the resources to do that. There's a significant shortage of mental health professionals in this country, and the fact that the patients are in the dialysis unit 3 times a week for the most part also limits their ability to go to their other doctor's appointments sometimes, or interact with their friends and go to family events. So it can be something that is very impactful in terms of your mental health. And we just try to support the patients the best we can when we see them there, and offer them options. That's all we can do. Yeah,
absolutely. And can you speak to any common misconceptions or myths about dialysis and what patients should know to separate fact from fiction? Because I think, when a lot of people hear dialysis, there's a connotation there.
Yeah, that connotation is that dialysis is a death sentence, just to be blunt, but it is not. I have patients who have lived decades on dialysis, And dialysis really should be, for most people, considered to be a bridge to transplant, where, you have a new lease on life. But people can do very well with dialysis. It is the one organ system that you can replace, the function of if that organ has failed in some reasonable manner to allow a fairly reasonable quality of life. So it is, I think, if people could see some of the newer technologies and talk to people who are doing dialysis now, instead of kind of going like, I never want dialysis because everyone I know who was on dialysis died. Things change. We improve processes. We look at things and we see how we can make things better. And I will say that I have noticed a significant improvement in even just in the last 10 to 15 years that I've been into practice.
Yeah, absolutely. Thank you so much for that. And I think it's something where, educating ourselves and being aware of new technologies that come out, advancements in the field really do bring hope to patients and their families. That's really important as well. Well, Dr. Tailor, thank you so much for joining us. We have one last question, which really kind of ties in with what you said. So looking ahead, in terms of the progress that we are seeing, what do you hope to see in the field of dialysis and chronic kidney disease treatment? And especially as a nephrologist, because from my understanding, there is a limited number of nephrologists for the amount of patients experiencing chronic kidney disease. So what role do you see nephrologists playing in driving this progress?
I hope to see a world where we don't have to use dialysis at all. I hope to see us being able to delay progression of kidney disease to the point where someone never reaches that or needs a kidney transplant. And if they do need some type of kidney replacement therapy, it's something that they don't have to, that doesn't require them to be stationary, that they can move and they can enjoy their life and they can interact with their loved ones and have the longevity that they desire. And I think the role that we play is keep advocating for research to be done to fund any initiatives that would hopefully meet those goals for our patients. So, and that's being done. There is, the National Institutes of Diabetes and Kidney Disease, and they do this work, and along with multiple other companies and organizations out there that are focusing on the field of nephrology.
Absolutely. Well, Dr. Tailor, it has been such a pleasure. Thank you so much. That was such an incredible conversation with Dr. Tailor. And Ursula, just, talking about the stigma of dialysis and breaking things down and, educating people. We're here, this event here is about empowering and informing, right? The more information you have, the better. And I think also Dr. Tailor spoke to the fear that a lot of patients have as well.
Yes.
And, that fear, it sounds like, is just crippling. And so I think that, making sure that healthcare providers create that safe space, right, where their patients can come to them with any questions, with any concerns, because it's very daunting, right? We're dealing with kidney disease, literally. And, for a lot of people, this is life-threatening and it's stressful. So I think the fact that he really addressed that and spoke to the fear is such an important aspect as well.
I think with any medical condition, mental health, acceptance, those are some of the steps that we really don't routinely speak about. And it's extremely important when you are battling any chronic condition that you have that rapport with your medical care team so that you're able to kind of express where you're having some of the challenges. Because at the end of the day, if you're having a challenge and you're not really voicing what's happening, that can adversely impact your care plan. And then from there, if you're not really executing your care plan, obviously the impact could be disastrous. So I really love the way that he emphasizes removing those misconceptions, having that open dialogue.
Yes,
is a crucial step to any success. And particularly with home dialysis, many people are very unaware that dialysis patients can treat at home. And the whole idea is you're going to be treating more frequently. It's a ton of responsibility, but there are I guess
significant benefits.
There's an infrastructure.
Yeah.
Yes, there's benefits, but there's infrastructures there to make sure that you're successful and that you're treating at home and that you're safe. And I think once those barriers are removed, that can be definitely a good pathway for you to kind of really embrace and open up, taking back some control of your life. You can travel when you treat at home. And you feel better. It's proven that you're more energetic, and overall, it's better on your cardiovascular system. I really don't think people understand, in general, the work that the kidneys do and how they are part of your cardiovascular health, which is vastly important.
Yeah, absolutely. And I think also the medical advances that Dr. Tailor spoke about, just incredible. I mean, wow. And that's something where I think, as technology evolves, it's really, exciting to see that there is hope. And that's also a really big reason that we're here today, right? Education, empowerment, but also there's hope, there's support, there's resources, there's education out there for you. We want everyone to be empowered around their health. And here at Podbean, there's so many podcast resources that we'll talk about in a little bit at the end. But it's something where, the more information you have, the better. And
Absolutely.
I'm so grateful to Dr. Tailor. Thank you so much for joining us. And next we have an incredible guest. Wow. Nicole Scharf is the Associate Executive Director of the National Kidney Foundation of Maryland and Delaware. And she has an incredible story that I'm not going to spoil. It's incredible. So no spoiler alert. It's so moving and so powerful. But she's also going to speak to the support for patients and the families of patients experiencing chronic kidney disease and what resources are available, right? She's also going to talk about the role community plays. And I really don't want to spoil it, but her personal journey is just incredible.
Yeah, I think Nicole probably this is the culmination of the educational summit on chronic kidney disease. But Nicole is living it. She's breathing this. This is her passion.
Yeah.
You hear stories all the time about people say, do what you love. But she's actually doing what she loves each and every day. And if she just saves one life, if she changes one person, family in terms of the level of support that they get, or bringing the community in, I think that she is the perfect example of someone who is really being philanthropic through her career and doing it in such a positive way.
Absolutely. Well, we're just so excited. And I think also, just hearing from so many doctors so far to have a human perspective, we're so excited to share this with you. So without further ado, Nicole, welcome.
Hello, my name is Ursula Scharf and I am with Podbean. And I am so excited to talk to my friend and colleague in the kidney disease community. Welcome, Nicole Scharf, who is the Associate Executive Director for the National Kidney Foundation, serving both Maryland and Delaware. Nicole, thanks for carving out a little bit of time from your hectic schedule to join Podbean to chat about chronic kidney disease.
Absolutely. March is National Kidney Month, so there's absolutely no other place I would rather be. Thanks for having me.
Oh, and anytime. So folks, before we really jump into really the meat of this particular segment, wanted to give you a little bit of background information. I myself personally suffer from chronic kidney disease. I am actually stage 5, so I'm technically an end-stage renal patient in need of a kidney transplant. And throughout my navigation through the chronic kidney disease community, I happened to bump into Nicole Scharf. And Nicole has a very interesting story about how she really came full circle with chronic kidney disease and becoming an integral part of the National Kidney Foundation.
Yeah, so I would love to share a little bit about my story. So I have been with the National Kidney Foundation for almost 10 years. And when I started with the foundation, I didn't even know what the word dialysis meant. I didn't know much about kidney disease. I'm not clinical, so I'm not a nurse. I'm a fundraiser by trade. So I had to learn all of these things. And the National Kidney Foundation completely opened my eyes to what a huge problem CKD is across our country. And I'm a very relational type of person. So I got close to patients within the dialysis centers that I would visit day in and day out. And I would see their struggle and how they lived their lives and what they were going through. So very long story short, I became friends with a patient who was on dialysis in Georgetown, Delaware. And she had recently been listed with a transplant center to get a transplant. And I thought, I'm going to check this out. I'm fairly healthy. I had done my research on living donation. So I went and got tested. As it turns out, I wasn't a good enough match for her. There was a little marker in my blood that when mixed with hers could have caused a rejection. So obviously we didn't want to go that route. So we entered what is called the paired kidney exchange through the National Kidney Registry. And what that is it's a big database that puts everybody in and blood types in, and they do a swap and figure out who's the best match for who. So ours happened to be a 10-person chain. And almost 4 years ago, I donated my kidney so that she could receive the gift of life. So don't know where my kidney went. It went to a stranger. I don't know. Somewhere on the East Coast is really all I know. And then my recipient, her kidney was flown in from California. So we both had our surgeries the same day at the same transplant center. And it was one of the best experiences of my life. So that has sort of driven my passion for this organization in a big way.
So let's really dive in and let's talk about this whole thing called chronic kidney disease. I know there's a lack of awareness. There's upwards to 1/3 of people within the United States that are walking around with this disease and they're not even aware. So can you give us a little bit of context about that?
Absolutely. There are 37 million people across the country that are estimated to have kidney disease. 90% of those people don't even know it. The reason they don't know it is because typically it's also looked at as it's called a silent killer, meaning you don't necessarily always have the symptoms head on until you're really sick. So people aren't recognizing the signs. And two of the biggest leading risk factors to kidney disease are diabetes and high blood pressure. So diabetes and uncontrolled high blood pressure can do severe damage to your kidneys. And letting those things go untreated can inevitably lead you down a road where you will potentially need one of two things. You will need dialysis if your kidneys stop functioning, or you will need a kidney transplant. Both of those things are treatment, right? A kidney transplant isn't a cure. It's just a treatment for you because you could potentially need another kidney transplant should that one fail. There's just not a cure. But the best results that someone has if they want to get off of dialysis and go the transplant route would be to consider living donation, but also deceased donation is an option. But with the 90% of people that have CKD aren't even aware of it. And, it's the 9th leading cause of death in the US. So it actually kills more people every year than breast cancer or prostate cancer does. And these are according to the CDC. So it's a big problem across our country. And it's also a problem that doesn't seem to be slowing down, unfortunately.
That's so interesting. The 9th leading cause. And to be honest, you really don't hear that much about it anymore, or ever, which is a little, I guess it's a little frightening. That's something that is really quickly emerging into a global pandemic. You think part of it has to do with the finances behind it, the economics, because it is a chronic condition that with dialysis, you can live for years, but also, with transplants, the cost of medicine is rising astronomically as it is. But can you give us a little bit of insight about the economic burden behind this and who it really impacts?
Absolutely. Well, one of the things I like to say, because I see it firsthand by the people that I know, the stories that we at the National Kidney Foundation hear about, and the people we meet in the community, kidney disease doesn't discriminate. There are children that are born with one kidney. There are people who have acute kidney disease, which is an injury to your kidney. There are people that it's hereditary for them. Polycystic kidney disease is hereditary. So there's a good chance that runs in your family, you're going to have issues. It's not always hereditary kidney disease as a general rule of thumb, but it can be, particularly where PKD is concerned. But oftentimes this is because of diabetes running in families, high blood pressure running in families, history of kidney failure. But also we need to look at things like age. If you're over the age of 60, you should be getting your kidneys checked if you have a family history of. If you're obese or you have heart disease, if you've had past damage to your kidneys in any way. Heart disease is a big one. A lot of people don't realize that what our kidneys are doing in our body, not only are they filtering out the waste in our body. So if you've got kidney disease and your kidneys can't do that naturally, that's where dialysis comes in. So dialysis is taking all the blood out of your body, it's cleaning it and it's putting it back. So it's a machine doing the job of what your kidneys should be naturally doing. And they can't when you have kidney disease. Your kidneys, they also help regulate your blood pressure. So oftentimes people with heart disease and kidney disease kind of go hand in hand. But to your point a minute ago about dialysis and the costs, what the annual cost is to Medicare per dialysis patient per year is about $80,000. That's huge. We're spending billions and billions of dollars on Medicare for CKD when it's much cheaper to treat that with transplant, because your life after transplant, your first year after transplant, you're only talking around $20,000 to $25,000 versus that big $80,000 number on dialysis.
So talk to me a little bit about some of the programs that National Kidney Foundation has in place, the level of support that you offer. I myself participated in the kidney walk, but what should we be looking for and how can we really, as a whole, get educated and get active in this community?
People that are faced with chronic kidney disease, starting dialysis, navigating how to go through the transplant journey, all of that is very scary. There's a lot of education out there, but it's not always readily available. Sometimes you have to look for it, and people don't oftentimes know where to turn or where to look. So that's where the National Kidney Foundation can come in and help. We offer so many resources to patients and their families who are dealing with this disease, and most of them are easily accessible on our website at kidney.org. But we have a couple of programs in place. One's called NKF Cares and one's called NKF Peers. So that program works in tandem. So the CARES line is a helpline for our patients to call. So you can speak with a trained specialist who will answer all of your questions, listen to your concerns. That's a toll-free number. It's 855-NKF-CARES. So it's 855-653-2273. Or you can also email nkfcares@kidney.org. We do speak English and Spanish right now, and they're available Monday through Friday, 9 to 7. And the Peers program is where you can actually get paired up with someone who has been through your specific journey. So if you're looking to get a transplant from a living donor and you don't know where to start, or you're scared, or your donor is scared, et cetera, you can call this helpline, and the mentors there are matched up with you to help you through that specific journey. Oftentimes, the reason people don't go towards transplant is simply they don't know how. They don't know how to ask somebody to donate a kidney to them. That's a really hard thing. That's a big ask. So we call it big ask, big give, right? It's a big ask and it's a big give, which we do virtually and back in person now. We have one coming up actually in April with University of Maryland. It teaches people how to look for a living donor. So we run through all of the first steps of transplant, how to find a living donor, what the evaluation process looks like, what the risks are, what the surgery looks like. How do you find someone to give you a kidney? How do you open up your mind to your circle of influence and start looking at not just your immediate family? Because sometimes people in your immediate family aren't matches, and that's very disappointing. But if you can look outside of that, you would be really surprised at what telling your story does, which is another hard thing to do. But by telling your story and getting it out there, it allows people to help you, and it allows people to connect the dots. And so through that program, we've been able to match people up to where they actually have been successful. They have found a living donor and they've gone on to have a kidney transplant. We also have online communities. We have online communities that you can join our Facebook groups for transplant or children with kidney disease or dialysis groups. All of these are available on our website. We have our patient network, which is a new program. The NKF Patient Network's the first nationwide registry for people with all stages and all types of kidney disease. And it's a research study to improve the understanding of kidney disease and how it affects people out in the real world. You can share health information, answer, survey questions about kidney disease, and it helps our researchers use that information that's provided, by people like you, people like us, to improve kidney care across our country. And there's also local staff resources. Something that we do that's unique in Maryland and Delaware is we have a patient emergency assistance program where we will help you financially through whatever hardship you're dealing with, whether that's utility costs, food, rent, transportation to and from dialysis. So those are all the resources that we have available. And there are several more too on our website at kidney.org.
So can you just share a little bit about some of the testing that you go through? Is there an expense to someone that decides to be a donor? Like, how are they covered? How does all that work overall?
That's a great question. Such a great question. So the answer to the second part of that question, is there a cost? No, aside from maybe if you have any travel costs, depending on where you're going to donate. The surgery itself is paid for by the recipient's insurance. But the process is very rigorous. I tell people all the time, if you want to know if something's wrong with you and you want a complete workup about everything and anything having to do with your body, go and try and donate a kidney. The reason it's so rigorous is because physicians and transplant centers are never going to take a kidney out of somebody that isn't healthy enough to withstand that surgery and be okay after living with just that one kidney. So if I had any cancer, if I had any sort of issues with diabetes or high blood pressure, those would have all ruled me out immediately, because certain cancers can be transmitted actually through a kidney transplant, which I learned along the way. Melanoma can be transferred. So you have to have an appointment with your dermatologist. You have to have all of your mammogram, if you're a woman, screenings up to date. You have to have a renal anatomy scan so that they can see how long your veins and arteries are, so that when they perform that surgery, they know exactly what they're looking at when they go in. So they take the healthiest of the healthy to be able to donate a kidney, because they want to ensure that you're not going to need that kidney later on in life. So the testing is a lot. I would say from the time I started my testing until donation day was only about 6 months. But in the grand scheme of things, that's not a really long time to do something that is so life-altering.
Also, let us add, it's completely confidential. So if you decide for some reason, if you're a match with a relative or a friend, and that particular person doesn't know.
Yeah, you're absolutely right. And that's hard to navigate for the recipient and for the donor, particularly if you're family or friends or anything like that. So it's touch and go. It's tricky to navigate. But what the transplant centers do, which I love and is really nice, they pair you up with two people. They pair you up with a social worker, and the social worker talks to you about all of those things, because you have to go through a psychology evaluation also to make sure that you're doing this for the right reasons. You're not being compensated. These are all things we have to talk about, that you're not being coerced in any way. And then they also pair you up with a mentor that if you're not comfortable talking to your surgeons or your physician or your social worker, you can go to your mentor and say, you know what? I'm scared and I think I want to back out. And that's okay. You can back out anytime up until you're put to sleep and going under that surgery. I think once you've gotten that far, you're committed and you're not going to, but it is an option and it is completely confidential. Yeah.
So talk to me a little bit about your healthcare team, because I know mental health is a big part of that, but also the role that your care team, your nephrologist, your clinic once you're in dialysis. I know for me, because I really view them as an extension of my family, because they are so very supportive. And at the end of the day, they want to make sure that you're given A, the best quality care, but 2, they want to make sure that you live the best quality life possible, whether it's dialysis or whether it's transplant.
A big initiative for us at the NKF is to be able to educate primary care physicians, right? Because primary care physicians are seeing so many more people than a specialty doctor is in some cases, and they're trying to look at the whole picture. So we want to make sure that they're armed with the tools to be able to recognize and diagnose chronic kidney disease, to be able to refer to a nephrologist. A good nephrologist is going to talk to everyone on your team. They're all going to be talking together because everyone needs to know what's going on. And the nephrologist, your care team, as you get worked up for transplant, they're working with those doctors. They have relationships with those surgeons, the social workers, the coordinators, the nurses. There are so many people involved in your care, whether it's dialysis or transplant, and they just all need to be working together.
So with that in mind, what type of advice do you offer patients, family members, anyone who's going through this journey? Because you do need a ton of support, not only physically, financially, but psychologically.
So you've got 90 to 95,000 people across the country waiting for a kidney. And last year we did about 6,000 living donor transplants. That's not enough. We need more living donors to balance those scales. And we did about 23, don't quote me on that exact number, but ballpark 22 to 23,000 deceased donor transplants. So those numbers aren't adding up. There's still a lot of people still waiting. And in some states you wait longer. And some people are, not up to speed on what they need to be doing to be listed. You have to go through a checklist just to be considered for transplant. You've got to keep up on all of your doctor's visits and do what you're supposed to do to keep yourself active on that list. But one of the biggest pieces of advice I would say to somebody who's on dialysis, somebody who's waiting for a transplant, been transplanted, has any connection whatsoever to kidney disease, get involved, get into your community. You can get involved with the Kidney Walk. We have them all across the country, kidneywalk.org. Find a walk closest to you. You will meet some of the greatest people that can become your friends that are dealing with the same thing you're dealing with. They're walking this journey, quite literally. Everybody's got a different story. That's the unique thing with kidney disease. Everybody's story is so vastly different, and you're just going to meet some of these people. The Kidney Walk is a vital source of how we're raising awareness and how we're raising those much needed funds to be able to help people on dialysis, help people with transportation. 80 cents of every dollar that we raise gets directly donated to research and put back into the communities that we serve. So get involved, tell your story. I know it's hard. I know some people are embarrassed. Some people don't know how to ask for help. But get out there and tell your story, and you'll be amazed at the people who are willing to help you. Just reach out and talk to your community, because help is right there. You just have to ask for it.
You mentioned that, you all are going to be going down to DC, to the legislators in March. The more I think that they see the faces behind this disease, the more willing they are to take action and really make sure that this is something that we get a handle on this.
They don't know what they don't know. And it takes a lot of voices to be elevated to do that. They want to hear the patient's stories and what people are truly struggling with day in and day out. Those are the voices that, when amplified, can make a difference.
Well, Nicole, this has been a wonderful conversation. I really do appreciate everything that you're doing personally, since I'm walking this journey myself. But I would really encourage everyone just to take the time to get involved, to donate, to walk. It's a real simple gesture. If you see somebody's story on Facebook or social media, share it, because you never know who's a hidden angel out there who wants to step forward and help someone live a longer quality life. Absolutely. So with that said, this concludes our dialogue, and I really appreciate you taking time to chat with me.
Wow. I mean, wow.
Selfless person, Nicole.
Yes.
For sure.
Yes, absolutely. And I think, with just the journey that Nicole has living that purpose, not only just through her career, but through her personal choices of donating a kidney, that's just so incredible. I mean, and I think she's just such a leader in action. I think that's just such an incredible takeaway. And then also the fact that she speaks about, what the National Kidney Foundation does, and, how you can get involved, what resources are there for families, what resources are there for communities. There is support. If you or your family or anyone you know is experiencing chronic kidney disease, I'm sure it can feel very isolating, but you're not alone. There are resources, there is support. And
I think that's part of the challenge.
Yeah,
it definitely is. You don't know what's out there. You don't know what's available. Just like Nicole mentioned, there's going to be a large number of people this year that are not going to receive a kidney transplant. And the list is only growing. So think about that. You have over 100,000 people each and every year that need to be transplanted, and probably only 25 to 30% are actually receiving a successful kidney transplant each and every year. So if you do the math, more and more people have to step forward like Nicole has in such a selfless act. I know it's a big ask. You have 2 kidneys, you only need 1 to actually successfully continue life. So giving the gift of life, knowing that you have changed someone, it changes you as a person to know that you've given something to someone who's in need. Just look at the numbers, look at the facts, and I think you will definitely see how important it is for communities to get involved, much like Nicole did herself.
Yeah, absolutely. And I think, just having someone from the National Kidney Foundation just to speak about overall, additionally, and apart from her story, but overall, the umbrella of support of people who are actively donating kidneys as living donors, lobbying Congress, working together, I think is so important. There's an entire community out there of people who are actively advocating for kidney health and for the improvement and treatment and resources for chronic kidney disease. So just such an incredible person and incredible interview.
Absolutely,
So yeah, thank you so much, Nicole, for joining us. This has just been such an incredible event. I mean, I think, with the quality of experts that we're able to share with you today, I mean, we're so excited. And our goal really is to provide resources, hope, empowerment, so that if you have any questions about chronic kidney disease, you're educated, right? You know what's out there. You know that, maybe fear is a factor. Home dialysis exists. You need to communicate with your pharmacist. If you are experiencing CKD, go in early, right? Look at comorbidities. I think these are all really important aspects of any disease, any health issue that you're working with. And, I think today we've heard from so many incredible experts. And I mean, here at Podbean, we host 640,000 podcasts. We host so many podcasts.
Great.
It's over that number. It's incredible. And just to see the kind of content coming from healthcare providers, I mean, the Mayo Clinic has Mayo Clinic Talks podcast, and they speak about these kind of issues. So there are resources out there for you. Pharmacy Podcast Network has over 50 shows. So you are going to find content from specified healthcare professionals that are really going to be able to eloquently provide trusted information as an authority within the space, as an authority within the industry, as a medical authority in a lot of ways. And obviously, that's not medical advice, and you need to talk to your healthcare professional. But I think, anybody who's a patient of any specific condition or has family who is, it's important to make sure that you're educated and that you're informed. Yeah.
No, I mean, I agree. I think this was a good start because there are so many experts that they're really approaching this from a perspective of trying to educate the patient and letting the patient know that you have options. I think part of the problem is once folks understand or realize that they have a chronic condition, the wall goes up, there's a fear factor. But, each and every one of these individuals that participated today, trust me, they're inundated. They're inundated with questions. They're inundated with patients. And the fact that they've taken the time to just educate us and helping us along our journey of creating quality content. Folks, there's 33% of you are walking around out there with chronic kidney disease, some known and some unknown.
Yeah.
So, really take a look at this information, get tested, ask questions, build those bonds, and know that the technology is there and that the healthcare is not here to push you along the track. They want you to live the best, highest possible quality of life that you possibly can. And they are here to support you through this journey.
Yeah, absolutely. I couldn't have said it better. And we're just so grateful to all of the experts and healthcare providers, and kidney I don't want to say industry, but chronic kidney disease community, and specifically in Nicole's case, to speak with us. And I think you're right. There is, I think Dr. Tailor spoke to this. There is that deficit of available healthcare providers, especially with nephrologists. So we're so grateful to all of our incredible guests today. And we've got their LinkedIn profiles here if you want to follow them. We've got links for the podcast that we mentioned. And
Yes.
I'm going to read our brief outro. It's been such a pleasure and such a rewarding event. So thank you everyone out there. And thank you for joining us.
All right, folks, become an organ donor.
Thanks everyone for joining us for Podbean's Podcasting Smarter Live series and our special live event for March, empowering those with chronic kidney disease, insights and strategies for improved health. This is not like our other events, and we're so grateful to all of our incredible panelists and guests that have joined us here today, including the Pharmacy Podcast Network and the Mayo Clinic and their podcast, Mayo Clinic Talks. For those of you who may be joining us for the first time, Podbean has live stream sessions like this one with top podcasters and experts. And if you joined late or you want to have another listen to these incredible experts, you can replay this live stream on Podbean's YouTube channel. We're brought to you by Podbean, and we're a podcast hosting and monetizing platform and home to over 640,000 podcasts. To start your podcast, head over to podbean.com today. Thank you all